And I want you people to join my live. As you can see, the title is Overcome the Disruption and the Transformation in the AIDS Response. And I did this certain forum. The forum is Nyatipin, that is for girl child. And I want you people to just Google Nyatipin and know more about them. Now, HIV and AIDS has been a pandemic globally, and remember, it is estimated that by 2024, 40.8 million people were living globally with HIV, and among these, 630,000 died of HIV related cases in 2024, and about 1.3 million acquisition of new infection of HIV in 2024. So that's why we had a World AIDS Day, which normally happens on 1st December. I was to make a video on that, but I was in a certain forum presenting. Now, the prevalence rate is also rising, which is around 3% in Kenya, and majorly women forming the larger number of 4%, while men is 2%. And the reason for this video is just to raise awareness about HIV, because our young people, the age of 15 to 34, they are the people topping the list in this HIV related illness. So I want you people to stay with me until the end of this video, because our main aim and the goal of this program we are running entirely globally is to end HIV and AIDS by 2030. In fact, it's one of the MDGs. So I want you people to pay attention, because this is very, very important to us. And also, it's very, very important to
I want you
us.
people to pay attention, because this is very, very important to us.
So, HIV/AIDS is something that we should be able to discuss into details, so that we end this by 2030. And remember that we are really targeting young men, and we want to reduce this infection as much as possible. So that's why I'm raising this awareness in terms of making you people to be aware of what is happening. It is a time that we should come out of that shoes that HIV and AIDS is what we call a curse, and even some myths and misconceptions about HIV. It is real, and what we normally promote as healthcare workers is that we want testing to be done in each and every facility. In fact, following up patient and registering them and testing them at outpatient level is very, very key. We want to identify new infection, because these new infections are the ones that are already making other new infections to arise. So we want to promote testing, because when we do test and we identify those who are positive, then we will bring what we call timely treatment, which overall will impact your health wise, and it will really determine the progression of HIV when we do testing early enough. So I want you to be very, very vigilant. And if you are listening to me, if you are watching this my channel, thank you so much for joining. And what I'm encouraging the general population is that at least do test once in a year. And if you fall in the high risk group, at least every 3 months, you should be able to know your status. It is very, very easy to do this. And Kindly note that when you are knowing your status, we do not just test you. We first talk to you. We do what we call pre-test counseling, and then we do testing, and then post-test counseling, and we give you your result. In fact, you are the person who is going to observe and tell us your result after we've taught you how to read that particular or result, or how to interpret that particular result. So testing is very, very important, and that is what we are encouraging, because one of the MDGs is to end HIV and AIDS by the end of 2030. We are in 2025. It is just 5 years uh, to go. So, ladies and gentlemen, testing is very, very key. And this message is also to all health practitioners. Kindly make sure that all, 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 of course, you must gain consent. All people who are visiting your clinic, visiting any facility, is tested of HIV. Remember, during the reign of our president Uhuru Kenyatta, he said that any person who has stepped in any facility seeking health care, by stepping in that facility, you've just accepted to be tested of HIV. So we want this thing to continue the way it was, and testing, testing is very, very key, uh, so that we can identify these particular issues early enough. There are people who have fear, the fear of unknown. They normally joke by saying that I don't want to interfere with where my HIV is really resting in peace. Now, I've stressed that if we diagnose you early, we will be able to help you early by identifying. First of all, we do what we call WHO clinical staging of yourself, whereby we have stage 1, we have stage 2, we have stage 3, and we have stage 4. Remember, uh, it is an era of test and treat. Kindly, if you are tested positive, do not buy time. Do not buy time. Do not just leave health workers. We normally try sometimes to really, really do the necessary as per the book in terms of counseling, pre-test and post-test counseling. But there are some few individuals who sometimes they say, I'm not ready. Now, when you are not ready, of course, we'll give you time. But we will tell you that by saying when you are not ready, you are inviting what we call opportunistic infection. You are interfering with your quality of life. And this opportunistic infection, they come in stages. Just to mention a few, when we are in stage 1, nobody will know. And stage 1 normally depend on the immunity of an individual. Some people, for example, I and you, maybe my immunity, that is my cluster of differentiation 8, that is CD4, is the normal CD4 is around 500 to 1500. So let's say your CD4 is around 1400 and mine is around 600. If you get HIV the same day, I will go down very, very fast because of my immunity. The natural immunity that I was born with is not at the maximum. So there are people who they say that since I got HIV, it's almost 7 months and now I'm not taking drugs and I'm okay. Yes, we accept that because of your immunity. But remember, you are highly infectious. You will infect even the whole country if at all you are really, really practicing unprotected coitus. So we encourage one another that testing is very, very key, because we do not want you to progress to stage 2. Stage 1 will just asymptomatic, there is no symptoms, just Some persistent generalized lymphadenopathy will just have some lymph nodes, and also during that stage you will have some flu-like symptoms, some slight fever, headache. Of course, your immunity is still going down, is still strong. You will not feel anything. This thing might be disappear 2 to 3 days. Only after sometimes it comes now worse, stage 2. Now, this now individual who will develop minor mycocutaneous manifestation, your skin will not be like the way it used before. You will develop some rashes. This is where herpes zoster will come in. You will have recurrent upper respiratory tract infection, homa. If you are a Luo, or if you know the Kiswahili dialect, homa yenye haishi kabisa. So homa kila mara, tonsils kila mara, tonsillitis every time, ear infections, mouth infections, oral infections will be recurrent. Upper respiratory tract infections will be occurring each and every time. So we don't want you to progress that. We don't want you to develop pulmonary tuberculosis, which is also in stage 3, uncontrolled diarrhea, uncontrolled fever. And also we fear you progressing up to stage 4, where we have the cancers and the lymphomas and even HIV encephalopathy, HIV dementia, that now you've been affected by toxoplasmosis. So we encourage you to do HIV testing. That is the main thing, even before we go to other forms of prevention. Because if we identify you early, we'll encourage you to start antiretroviral therapy, unless there is a hindrance to you starting antiretroviral therapy when you are being diagnosed positive, according to the guidelines which is guiding us. It's just our Bible. For example, if you have TB meningitis, we may delay HIV drugs for at least 2 weeks, so that you don't develop what we call IRIS, immune reconstitution syndrome. So testing. That is what I'm encouraging now. If you're watching me and you've not known your status, and this one even goes to health workers, they are really poor in visiting the testing sites. They encourage, but with them, they are very poor. If you are a health worker, when did you go for HIV test last? I'm encouraging us all in different sectors. If you are a chief listening to me, sub-chief listening to me, just from the community level, encourage people to go for testing. The CHVs, community health, the volunteers, encourage testing at all levels. Start with the community, talk to these people, let them accept and come to the facility for testing, so that we improve quality of life when we've identified this particular HIV. Now, education, the one I'm doing, the community education and preventive methods, is very, very key. And this one we are stressing for those who are HIV negative and even those who are HIV positive. Safe sex practices is very, very key. I normally say in clinic, condomize. Kindly use protection during your sexual intercourse, unless maybe your partner you trust your partner. But if you are falling in the key population, those who are really at high risk, those truck drivers, commercial sex workers, men sexing men, people who inject drugs, kindly, if you are performing sexual intercourse, kindly condomize. Use condom. And don't just use condom. Not round 1, condom, round 2, no condom, round 3, no condom. No. Consistency is very, very key. Consistency is very, very key in terms of that condom use. Now, we have other medications that can help us to prevent HIV. And my videos, I've talked about PrEP, I've talked about PEP, and I've talked about the two majorly. Now, PrEP now is still available as a oral medication. This is the drug we give. PrEP is pre-exposure prophylaxis before you acquire HIV or before you uh, be disposed to the risk. So this is the drug that really helps people a lot. Uh, it has done a lot to discordant couples, that is couples who are one is positive and one is negative. It has really helped. And those commercial sex workers who are really at high risk, it has helped a lot. And even some healthcare workers have started taking it when you are at high risk of acquiring HIV. Perhaps you work at the blood bank and you fear maybe you maybe get a spillage. Um, this is the best drug for you. So it is available at the government hospitals and is very free, even faith-based organization, even some private hospitals who are offering care and treatment. This drug is very free. Do not buy it. It is free in the government hospital. Just come, we register you. Remember also the government is also planning to bring lenacapavir. I do not want to forget about lenacapavir. I've made a video about lenacapavir. Just go check it. It is a preventive method of injection in terms of PrEP. So instead of taking that oral medication that you take daily, the government wants you to just come for one shot every 6 months. So they did promise that by January 2026, it will be rolled out in the facility. The only issue I have is that they were going to charge it around what they were saying was they were going to charge around 6,000. So if we are still waiting for that injection, embrace PrEP if you are at high risk. If you know you've met different types of sexual partners within a week, come for PrEP. In fact, we will not encourage you to take PEP because PEP is only helping you when it's just an emergency drug. When you are having an intercourse with someone of a known status and maybe condom burst, or maybe you are a health worker, you need stick injury, or uh, you are working in a blood bank area and you fear spillage, PEP is for you. And when you are having an intercourse under influence of recreational drugs or influence of alcohol, and you can't negotiate for condom use, PEP will really help you. So we encourage you to come for this one. If at all there is an exposure, because this is uh, post-exposure prophylaxis that we give you. So do not fear. Do not fear. I work at the chronic care center, and I normally prescribe PEP and PrEP. And what is coming out clearly, because PEP is the ordinary TLD, tenofovir, lamivudine, and dolutegravir that we normally give to the general population when they have HIV, or TAFLD, tenofovir alafenamide, lamivudine, and dolutegravir, if at all they have kidney issues. So there's some stigma that is going on that I fear if somebody sees me with this drug and it is the same drug that somebody or a neighbor or a friend is taking for HIV, will they say that I've also acquired this? So we want you to avoid stigma and fear, because you are taking PEP just for only 28 days to prevent yourself from acquisition of HIV, and it is 99% effective, 99.9 to be precise, just like PrEP. So take a step of faith and know more about PrEP and PEP in those my videos. And those people who inject drugs, we are really encouraging you to stop doing that. Those who are sharing needles, because That is the one other way of getting HIV in a very, very easy way. So, if at all you do this, there are methods that if you come to the facility, we will teach you, because we do not want you to continue doing this because they have negative side effects into your system. So, we want to fight this. We want you to have safe sex, condomize every time, make sure you use PrEP and PEP, and avoid sharing needles. Now, fighting stigma and discrimination is very, very important, because stigma is what is fueling non-adherence and failures, and drug resistance in HIV. Because most people who are still stigmatized with HIV, they will not adhere to the drug. First, they will not even come to the clinic. They will not keep their appointments, and they will be IIT, interrupted in treatment. They will be lost. We used to call it lost follow up. So we want you to avoid stigma at all cost, and this one can be even discussing other people who are positive with other people. That is also stigmatizing them and profiling them. It's not very, very key. And also to the healthcare providers, and we talk about stigma, and we are all really, really poor in maintaining confidentiality of patient. Do not talk about a patient who is on care with anyone other than your colleague, who is a practitioner working with you in the same department, or just who want to find out more about the patient in terms of care. So, we want you to reject the myths and misconception about HIV. Right now, I'm a Luo. We used to believe in something called Chira and a curse if you have HIV. And we used to believe that when you have HIV, then you are cursed, your life will soon end. So HIV will not kill you. Only opportunistic infections will do away with your life. So when myths and misconceptions are still revolving around our mind, then we will not be able to help this particular individual. So I want you to believe in yourself, and if you've been tested and you are HIV positive, reject myths. Don't listen to the second opinion. The only opinion that you should seek is a healthcare provider, and who has a vast knowledge on HIV and AIDS care. So don't just go around and start discussing about HIV with somebody who does not have knowledge. He will not give you uh, the knowledge that you need. Now, we want you to adhere to this particular drug. Now that we've tested you and you are positive, importance of adherence normally is very, very nice, because we are encouraging what we call you to you, undetected viral load and transmittable. And this one has helped very many in HIV care, particularly those who are discordant, and also prevention of new infection. There are some people who have indulged themselves in sexual intercourse, of course, with people who have been confirmed to be HIV positive, and they end up not acquiring the virus because of undetected and transmittable. So, my fellow viewers, adherence is key. You know, if we do test, if we give you counseling, we'll be telling you about the drug itself. We'll tell you about the side effects of this particular drug. We'll tell you even the timing, tell you to have a watch, even a radio, to maintain time of taking this drug, so that our main goal is to improve the quality of life by suppressing HIV virus. So, undetectable and transmittable adherence is very, very key. Youth empowerment to the vulnerable group. What I'm doing, I'm educating the youth and the women and those who are vulnerable, and also anybody who may pick this information and share it with people. And for key population, those who are at high risk, For example, I've mentioned them, but I will continue mentioning them again. Men who sex men, those men who have intercourse with men, sex workers, and their clients, they are at high risk. So condomize is very, very key. Condom is very, very, and consistent use. People who inject drugs, I've talked about this. Even the truck drivers are constantly at risk. So we are empowering these people so that we reduce the new infection. We are encouraging safe sex and testing because ending HIV is not an uh, individual work. It is not my work. It is not your work. It is not one person. It is not even one sector. It is not one government. It requires all of us, all care workers, politicians, governors, deputy governors, everybody in politics, educators, teachers, pastors, those who are in religious departments, to come out clearly and embrace and talk. I saw a policeman who was talking about PrEP and talking about HIV and talking about adherence. The policymakers, they should come out clearly and tell the communities who still believe that there is no HIV. Let this message be disseminated to all corners. And let's take care of our mental health. It's very, very key because psychologically, if you are not prepared to take this pill, we will not swallow it. We will not take it. We'll develop depression, we'll develop anxiety, suicide ideation. We must take this pill and kick out those fears and anxieties. And we stop discriminating those who are already on care. We kick away stigma, and we want you to be not suffering in silence, because if you've been diagnosed of HIV and you have not been initiated on antiretroviral therapy, you are really, really at high risk of developing opportunistic infections that I've mentioned. Just to mention them, we don't want you to have TB meningitis. We don't have to have pulmonary TB, cryptococcal meningitis, which is very, very difficult to treat. In fact, when they present in the ward, some do not even pass day 5 with those amphotericin B because it's very, very nephrotoxic. It's very toxic to the kidneys. So we do not want HIV encephalopathy. Of course, we'll give you Septrin to prevent you from acquiring Toxoplasma gondii. It's affecting the brain. And we'll continue monitoring even CS cervix screening, cancer of the cervix screening. We do it for free. We encourage men also to check their prostates and also their laboratory investigation that are very, very key for us, for the people who are on care, like the drug we are giving, that is TLD, tenofovir, lamivudine, and dolutegravir. The tenofovir part is being eliminated through the kidneys, and it's very, very important for you as that person who is on care. Clinicians will guide you, nurses will guide you, all those healthcare workers will guide you. At least do your creatinine levels at least once in a year. Creatinine levels is very, very key. Or even do full kidney function test, because if we diagnose you with any form of kidney disease, then there is something we normally calculate which we call creatinine clearance. And from serum creatinine, the blood we took, plus your age, we will be able, and your weight, we will be able to determine whether the bottle that you were given, the drug that you were given, the blue bottle and the white bottle, the longer one, is very, very safe for you. If creatinine clearance is showing some signs of kidney issues, we may switch you to that, the smaller one, the one called tafldine, tenofovir alafenamide. And if you are still not responding well, or there is a level of your creatinine clearance, then we may change mostly to a drug that is very, very safe with your kidney. So we'll opt for abacavir, lamivudine, or dolutegravir. So let's encourage testing, and ABC. That is, abstain, be faithful, and use condoms every time. And if you are HIV positive, high active antiretroviral therapy is very, very key for you because they improve the quality of life and will be following you constantly with what we call viral load. We'll do your CD4, and our expectation is that CD4 should be rising. The viral load should be going down. So we want you to be virally suppressed, the one we call anti non detected levels, low density levels of virus in your system. So when we do this, we will be able to help you. Of course, we will even encourage what we call family testing. My viewers, there are some times that health workers do walk from to door, door to door. First, do not chase them away because of course, they have a permission from the county governments to do that. And before they test you, they will gain your consent first. Even CHV sometimes do that. They will gain your consent, and we encourage family testing. The reason why I'm saying this is that now it's story time. As a person who has been working in a chronic care center for long, we find that your spouse, a wife is taking drugs somewhere, husband is taking drugs somewhere, or they are taking drugs in the same facility and they have never met. Coincidentally, they meet one day and it's a mess. Blame game. Who brought the disease? We do not want to reach at that level. That's why we talk about something called disclosure. Disclosure is very, very key. Telling your spouse that this is what is taking place. I have HIV. And this one will even improve adherence because if you have not disclosed your HIV status to your spouse, how will you take the meds? How? How will you take the medicine? Because you will be hiding. Mm. Or if you are the office guy, you will be taking them at the office and then swallowing them there. And weekends, you just carry two. That's what some people do. So, we encourage even disclosure to our children. For now, we are getting very, very difficult time to manage some adolescents because their parents did not disclose to them in time. Disclosure is a multidisciplinary teamwork, and it starts with parents, not even us clinicians. It starts with you, the parent whose child has been affected. There's a way we teach you to start nurturing them because their mind cannot comprehend what HIV is if they are 2 years, 3 years, 4 years. By 5 years, there's a way we tell them a child who is 6 years should be knowing just a glimpse that is taking the drugs. At 7 years, disclosure should be full. The child should know that I'm taking antiretroviral therapy because I have HIV virus. But now, problem comes. We've done our best. We've done partial disclosure, and now we want to transition to a full disclosure. The child still does not know. The parents is not willing. Sometimes they say that muache kwanza, leave him first. He's still young. So disclosure to your children, and even we encourage you to tell even other relatives. Though we know sometimes this one may be so hard because human beings were born to talk and to talk anyhow. Because if they don't talk, they will feel bad. That's how we were born. That's how people were born. We cannot talk to monkeys. We only talk about men. So thank you so much, CCC Homa Bay, vlogging live from Nakuru County. Thank you so much for joining this. So, disclosure is very, very key for both children and adults, and this one will improve adherence. And when adherence is improved, there's what we call quality of life. So, guys, I'm summarizing because I wanted to go live for 30 minutes. What I've talked about for those who have joined me is that we are raising awareness of HIV in relation to the 1st of December, where we had World AIDS Day. And the main aim is to end HIV/AIDS by the year 2030. By the year 2030. So, we want to overcome the disruption of the AIDS, and we want to transform these rates by responding very, very fast. And by raising awareness, the first thing is to promote testing. And I did say when I was beginning that testing is very, very key, because if you are an individual watching me for the past 1 year, you've not known your status, you are not doing well. Just walk in any facility and know your status. We want to prevent progression of HIV by testing you early. We don't want you to be progressing to stage 2, stage 3, stage 4, because this one will interfere with your quality of life. And also, we talked about community education and prevention methods, and I did talk about safe sex practices, and I was encouraging everyone to condomize. And we also said that the government is soon introducing an injection, the PrEP injection. So we should have this in the back of our mind. And also, those who are at high risk of HIV, those who are negative, we encourage you to come for PrEP. PrEP, kujeni mchukue hii dawa, iko free, hakuna pesa yenye mtalipa saa hii. So PrEP is very free. That is pre-exposure prophylaxis drug. There are two drugs that you take, and these ones give you protection 99.9%. Even if you have sex under influence of alcohol, condom bars, you don't worry, because it is 99.9%. PEP is also there. This is now emergency. We don't just take it on daily basis. We take it all for only 28 days, and it prevents us from, that is post-exposure prophylaxis. Avoid sharing needles for those who are sharing needles always. And we talked about fighting stigma and discrimination. We want to reject the myths, and because these are the things that fuel stigma. Supporting those who are living with HIV is very, very key. Kindly do not discriminate them, do not profile them, do not just leave them unattended, particularly the young group, the one that I mentioned between 18 to 35. They are the one now topping the list in terms of new infection. So youth empowerment is very, very key. So the adherence that I talked about, we said that when you have low viral load, the viral load is undetectable, and now you cannot transmit much. Let's continue educating these young people, educating our pregnant women, and those who have higher risk, like the truck drivers, men sexing men, sex workers and their clients, people who inject drugs, and let them be encouraged to continue using antiretrovirals in a very, very good and very, very encouraging way. And as I conclude, is that this idea of HIV and AIDS, it's not one person's war. It is not my war. It is our war. It's not for one person. It's not for one sector. It's not for one government. It requires MDT, multidisciplinary team, countrywide, globally. Pastors, healthcare providers, educators, community leaders, politicians, policy makers, they should come together and talk about HIV in any forum. They just remind us, so that this fear, discrimination, stigma, and suffering in silence should end. And more so, let's encourage testing. And if you are HIV negative, ABC is very, very key. And if you are HIV positive, we also deal with the ABC: abstain, be faithful, and use condom. And if you are positive, high active antiretroviral therapy is very, very key for you. So those who are watching me, I welcome questions. And if you have any question, you can drop, so that before we end this particular session. Um, as I'm talking to you, I'm in blogging live from Nakuru County. We are doing what we call mental health and in HIV, because it has been an issue. Because if you don't talk about mental health, people will not adhere to drugs. And if you don't adhere to drugs, it will affect your quality of life. So, see you in the next video, and make sure that you subscribe to this channel, turn on the notification bell for more videos that I will post, and always share this particular video. Thank you so much as I end this particular live. Muchas gracias.